15 years now, this country has had a massive effort at the federal, state, and local level of preparedness for pandemic. Now, that largely has been, as I said in those remarks, about pandemic flu preparedness. We knew about SARS, we knew about MERS, which were earlier modifications or variants of the coronavirus. None of those achieved anything like what we're seeing today. But that's why for successive presidencies, including the leadership of President Trump, there has been a great focus on pandemic preparedness. In fact, it was just in November, I believe, that the president signed the Pandemic Flu Preparedness Executive Order that we have also updated the Pandemic Crisis Action Plan, which has been the playbook from which we've been working, the Pandemic Flu Plan, the action plan from which we have been working that coordinates the whole of government, whole of economy approach here. So we've all been very focused on pandemic preparedness. That's what we do. But this particular strain of pandemic, who would have known this particular strain?
But Secretary Azar, if you are preparing for a pandemic, if this government we're preparing for a pandemic, why is it we don't have enough masks? Why is it we don't have enough medical equipment in this country?
Previous administrations gave us very little ammunition for the military and very little shelf space. Let me just tell you, you know it, you know the answer. The previous administration, the shelves were empty. The shelves were empty. So what you should do is speak to the people from the previous administration, Jim, and ask them that question. Because the shelves were empty, and you know what else? The military shelves were also empty. We had no ammunition, literally. That was said by one of your favorite generals. We have, sir, we have no ammunition. Guess what? We had very little medical supply also. All right. Go ahead. We'll get it back. We'll get you back. We'll get you back, please.
What about that question?
Jim, I said we'll get you back. Please, go ahead.
So I wanted to ask about the DPA. So you said that there will be a ban on exporting of all, what does it cover? So masks, gloves, what else is included in that order? And are you concerned?
But if somebody ordered, if Italy, if Spain, who has big problems, these are countries with tremendous problems, France, if they ordered, if they have long-term orders and they're in there and they want to get certain things, I'd let them go out in certain instances because I think it's only fair. They have problems that are proportionately or relatively bigger than our problems. So if they ordered something and they're waiting for, as an example, masks made here and going to Italy, I'm not going to be stopping that. I think it would be very unfair. And by the way, speaking about being fair and unfair, two very big cruise liners, as you know, I allowed them to dock today. We worked with the governor of Florida, as you know, Ron DeSantis, and we worked on it, and we had tremendous security, and we took the sick people, and we're working with them. We have doctors, we have great doctors, military doctors, and from a humane standpoint, not that we're in love with this, these are two massive ships, but we have to take care of people. We have to take care. We sent many back to Canada. The Canadians came and worked very closely with us, as did the UK. We had a lot of people from the UK, and we took care of the Americans. We took care of the sick. We had some people very sick. I think we had 3 to 4, maybe 5 people that had died on the boat, one of the boats actually, and we had to take care of these people. So we could have let them float aimlessly into the ocean looking for port, as they've been doing for a long time. And I made the decision we had to take them in, and Homeland Security and a lot of other people did a great job. But we had to help people. These are people that were very, very sick. Some were dying, some died. Please.
Go ahead.
Yeah, go ahead.
Mr. President, your staff today said that people in close proximity to you and the Vice President will get a coronavirus test. I'm wondering, are you concerned that the people you've been hanging around with may have the virus?
No, I'm not concerned, no. I had a test yesterday.
What's the reason for the order for people who meet with you or talk to you? Why?
I don't know. I mean, I heard from the oil executives, these are people, most of them had not had the test. And frankly, I think they left the room feeling good about a lot of things, but they felt good about the test. This was a test that took, I guess, 13 minutes to have it finalized. They took the test. I don't know. I didn't know they were doing that. Maybe they did it just for them. I don't know. But it seems that a lot of people, because now we have tests that really work well. Abbott, in this case, Abbott. We have other tests being developed right now that are also fantastic. The original tests, the ones we inherited, Jim, as an example, they were broken. They were obsolete. They were not good tests, and that's what we got stuck with. We've developed some incredible tests, but this took 13 to 15 minutes, and they were all fine.
On the DPA,
Go ahead, finish your question.
So I just wanted to ask, the problem some people have raised is that if the U.S. stops exporting, what you could have is other countries then deciding reciprocally that they are going to stop exporting, and that the result of that then will be a net decrease in the amount of supplies that American doctors, American hospitals have. How do you address that?
Well, I address it in the following manner. We really are very well supplied. We are not the principal. It's the hospitals, the states, the cities. They're supposed to get everything they can and stock up in case something like this happens. But nobody could ever have assumed that something like this happened. So we started supplying. We brought tremendous amounts to New York today and over the last few days. We brought them to Louisiana. We brought them to Michigan. We brought them to Los Angeles. A lot of equipment. You read the amount of masks that we had. I think I said over 8 million masks. The N95 masks, the more expensive, more complicated, better, whatever masks, the ones that want to use in the hospitals. We have millions of them now, and we've given them to a lot. We sent to Bellevue in New York today. That was from Mayor de Blasio, 200,000 of them. But we have 8.1 million. We're going to have more than that. And we're getting them from various sources, including the military. We're rapidly then replacing them because we have to replace them in case there's another emergency. I would be gowns too. We have many gowns being delivered and have been delivered. Our people have done an incredible job. Most people have said now, and I said this yesterday, governors have said, thank you very much, great job. If they're a Democrat governor, in some cases, not in all cases at all. If I said, here's 1,000 ventilators, how many do you want? We want 1,000. Here's 1,000. You got them. But you know what we're going to do? We're going to add another 5,000. Is that good? They said, wow, that's great. And then if Jim Acosta goes and says, are you happy with the president? No, he should have given us 10,000. That's what's happening. You know why? Because that's a standard political answer. And that's a shame, because we have done a job like nobody's ever done a job. But we've just delivered a lot of masks. We've just delivered a lot of gowns and protective gear. But you're talking about a massive number. But as of this morning, people were very, very happy. Steve?
Will executives ask you for a bailout?
No, they didn't ask for a bailout. No.
Ask for?
It was really more of a discussion than asking. We did discuss the concept of tariffs because, as you know, this was a dispute among a couple of countries that I think they want to be able to get it solved. They had a dispute, they had a competition, but they want to get it resolved. Russia and Saudi Arabia, I think they want to get it. Yeah, I think they want to get it resolved. I think they're working very hard. I mean, they told me they want to get it resolved. They're working very hard. Go ahead.
Thank you. Yesterday, Jared Kushner said the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpile that they then use. What did he mean by our?
Well, why didn't you ask him?
And
I mean,
given the fact that taxpayers from
what's that?
every
It got
state
you.
needs
I got
to
you.
work.
You
No,
used
it's
the
not a
word
gotcha.
our.
What do
Our,
mean?
you know what our means? United States of America. That's what it means. It means
the states.
our. It means the United States of America. And then we take that our and we distribute it to the states.
But why did you
Not that
say
we
it's
have
not supposed to be state stockpiles that they then
because we
use?
need it for the government and we need it for the federal government. But when the states are to also
Then
keep
you're giving it to if it's not to the states.
to keep for our country, because the federal government needs it too, not just the states. But out of that, we oftentimes choose, as an example, we have almost 10,000 ventilators and we are ready to rock with those ventilators. We're going to bring them to various areas of the country that need them. But when he says our, he's talking about our country. He's talking, he's talking about the federal government. I mean, it's such a basic, simple question, and you try and make it sound so bad. You ought to be ashamed of yourself. You know what? You ought to be ashamed. It's such a simple question. He said our, and our means for the country, and our means for the states, because the states are a part of the country. Don't make it sound bad. Don't make it sound bad. Go ahead, Steve. Go ahead, back here. You just asked your question. You just asked your question in a very nasty tone. Let's go.
You didn't give me an answer.
Please, Mr. President,
I gave you a perfect answer. You know it. Go ahead.
well, just to follow up on that, when we have the federal stockpile I mean, isn't that designed to be able to distribute to the states?
Sure, but it's also needed for the federal government. We have a federal stockpile and they have state stockpiles. And frankly, many of the states were totally unprepared for this. So we had to go into the federal stockpile. But we're not an ordering clerk. They have to have for themselves. Now, some of the states were in good shape. Some of the states were not in good shape. That's probably something you could expect. We have been helping states. We have been spending a tremendous amount of time, effort, and billions of dollars on making sure that they have what they have. I mean, take New York. We built them hospitals. I built them 4 hospitals, built them medical centers, sent a ship with 1,000 rooms and 12 operating rooms. And then on top of that, gave vast numbers of ventilators and vast numbers of surgical gowns, equipment, masks, everything else. Now, they had a chance to order ventilators over the years. They had a chance to order a very big, but they didn't choose to do it. We were there and we helped them. And I think the governor of New York is very thankful for the help that we gave. But we have a stockpile. It's a federal stockpile. We can use that for states or we can use it for ourselves. We do use it for the federal government. We have a very big federal government. Go ahead.
You decided not to use your powers to be essentially a traffic cop for all the essential medical supplies that are needed.
We're not a traffic cop. We're a humanitarian cop. We help. It's like the ships. Do you think we wanted to take 2 big ships into our country that have obvious problems, and you know the problems I'm talking about? So I have a decision to make. Do I take them in or do I save lives? Okay? Do I take them in or do I save? I decided to take them in. And we have tremendous protection. We have great doctors there to help the people. They had 4 or 5 people that died. That was as of last night. They died on the ships. We took care of it. And now the people are in the process of, and many are already back in Canada, they're back in the UK, United Kingdom, and many of them were American citizens. Some were very sick. We're taking care of the sick people. We're testing all of the others very, very carefully. Very, very carefully. They are being tested like you wouldn't believe. And we solve a humanitarian catastrophe. You know why? Because nobody else would take the ships. Nobody else would take them. So we docked them in, I think, Fort Lauderdale.
Why you don't say we're the federal government and there's a shortage of masks and other things, and we're going.
We do say that. We say and we use the act. Excuse me. We do say that and we use the act, and we've used it a number of times very powerfully. And a lot of times we don't have to use it because we say we're going to use it if you don't do this or that. And then we also have companies that act incredibly well. We have plenty of them, mostly them. But we've used the act very powerfully. And a lot of times you don't have to exercise the act. All you have to do is tell them, look, if you don't do this, we're going to use the act. And we've done a good job with it, maybe a great job. Yeah.
Mr. President, there are news reports that you want to sign the stimulus checks that are going out here in several months. Is that right? You want to sign those checks?
I know. There's millions of checks. I'm going to sign them? No. It's a Trump administration initiative, but do I want to sign them? No. The people are getting their money. There's a lot of stimulus going in a lot of different ways. There's also stimulus going for companies that would, if it weren't for our government, would not, and some companies that were very strong a month ago. Again, we had the strongest economy in the world. We had our best ever. We had probably the best economy in the history of the world, bigger than China, bigger than anybody. And one day we have to say, close it up, stop. Everybody go home. And you know what? It's pretty tough to do that.
That's another thing. There are rumors that these checks may not go out for another.
Served with ventilators, we're going to find out. But we have other states to take care of. We have a big problem in Louisiana. We have a big problem in Michigan. We have a big problem in 7 other really strong hotspots. But we're doing the best we can. I wish they did the original orders 3 years ago. They would have had all the ventilators they needed, although even then they wouldn't, because if you look at what the original request was from New York, it was far greater than anybody ever heard. And we've supplied a lot. I told you, we supplied some just today to New York, and we supplied some yesterday to New York City. Did you have one in the back? Yeah, please.
If I could say, this is why the question of the stockpile that was asked earlier is so important.
I don't think that was the question.
No, it was a very important question because what Jared Kushner said yesterday is that the federal stockpile is for use by the federal government, not for the states to have access to. So you seem to be saying different. So did Jared Kushner misspeak yesterday?
No, he
is that
didn't. He
federal
didn't misspeak.
stockpile?
He used the word
available?
our. Okay, our. Our is referring to our country. The states, to the best of my knowledge and to the best of your knowledge, are a part of our country. We are taking what is in the federal stockpile and we are helping states all over the country. But we also want to keep some because when that surge comes, when you hit those peaks, we have to be able to have the flexibility to take those ventilators and bring them to Louisiana, New York, Detroit, different places. That's all.
We will be using
But the
them for
word,
states that
oh,
need
of
that.
course, we're not using them anywhere else. We're not going to be using them, John, anywhere else. But we want the flexibility because, we don't even know when the surge is coming, but it's coming soon and it's going to be big. And some areas won't have it. Some areas will be pleasantly surprised, just like we've been. You look at the chart. States that I thought would have been maybe a disaster turned out to be, really, they've done a great job. Some states are really trouble. But you don't know. You don't know. We have great flexibility. I would have preferred giving them all out. We'd have nothing. And now when we have a surge, we can't get them back from where we gave them because it's very tough to take them back. So we have tremendous flexibility. And it could be New York, it could be Louisiana. Those are two that are really rough. New Jersey is very rough. And they've done a very good job in New Jersey, but New Jersey is very rough. Go ahead, please, Flippin.
Yes, the question is about the CDC guidelines. I know that they've changed over time from February, and
The guidelines relative to which? The
for
masks?
instance, social distancing and the number of people who can gather in a group and so on. And now we have this measure about wearing masks. And I know you told Steve about why you don't want to wear a mask, but I'm just wondering if you can tell us more about why, because it would
I just don't choose to.
an example.
They're not mandatory guidelines, they're guidelines. They suggest you could wear them, you don't have to wear them. In fact, the director is here. If you want to say a couple of words about it, you can if you want. You don't have to.
And your decision.
But basically, it's a voluntary thing. State director, doing a good job.
Thank you very much. I think I just want to reemphasize, I've said this before, that we're not defenseless against this virus. We have a powerful tool, a powerful weapon, that is social distancing. And we've continued to embrace that with the President's initiatives to slow the spread of coronavirus. We're constantly looking at new data, and as the Surgeon General said, one of the new information that became more clear to all of us is there's a greater number of people that are asymptomatically infected than we previously thought. As Ambassador Burst said, that may be inversely related to age. And so really the purpose here is first and foremost to embrace the social distancing. That's the number one thing. That's the powerful weapon. And this virus has a great weakness. It can't jump from one person to another if it's got to swim more than 6 feet. And this is why we really want that. That said, we now know that there may be individuals in areas of significant community transmission that may be asymptomatically infected. And we know that a face barrier can actually interrupt the number of virus particles that can go from one person to the other. So as was said by the Vice President, the purpose of this face covering is to be another adjunctive mitigation strategy to protect someone from spreading the virus from themselves to someone else.
And I was just tested also, so I assume I don't have the virus, so I don't have to worry about spreading it. Okay? Please, go ahead.
Mr. President, I want to make sure we're clear. When you mentioned tariffs earlier that came up in a meeting, are you considering tariffs on Saudi Arabian oil? And then also,
look, tariffs have made a tremendous amount of money for our country. I put them on China, I put them on other places, and other countries tariff us, and they take advantage of us, and they have for many years. Look, countries have taken advantage of the United States for years. They've ripped us off like nobody can even believe, whether it be on manufacturing, whether it be on exporting, whether it be on almost anything, including military, where we provide virtually free military assistance to countries that frankly take advantage of us, don't even like us, okay? So this has been going on for years. They tariff us, they create artificial, you could say non-financial barriers, which are worse than financial barriers. You can't sell farmers, they won't take our, and yet they'll take us and sell into us. And we Look, they've taken advantage of us for years. Tariffs are a way of evening the score. Tariffs are advantage of us for years. Tariffs are a way of evening the score. Tariffs are a way of just neutral. Oh, am I doing it now? No. Am I thinking about imposing it as of this moment? No. But if we're not treated fairly, it's certainly a tool in the toolbox.
And what about with, would you consider maybe lifting sanctions or giving some sanctions
Well,
relief?
it would be the same thing. No, it would be the same thing. They are having a dispute, the two countries. Because it's really hurting the energy industry. Russia's being hurt unbelievably badly, and Saudi Arabia is being hurt unbelievably badly. Russia is being hurt unbelievably badly, and Saudi Arabia is being hurt unbelievably badly. Because oil, all right, it's a price from the 1950s. They are being hurt very badly. I think they're going to set.
New York State jumping.
On the oil, why do you think
Mr. President,
raise the price? Why do you think you haven't been more successful in getting them to increase production in Russia and Saudi Arabia?
Well, they have increased production. That's what they've done. They've increased it so much that there's, so you meant the...
In the industry, want to make sure everybody is on the same page. Live in Aberdeen, Ryan Martin, DAKOTA News Now.
All right, Ryan, thank you very much. Taking a quick second.
America, the National Guard building field hospitals in Michigan and Connecticut, disinfecting nursing homes in Georgia. But here in New York, Governor Andrew Cuomo giving the troops different marching orders to seize ventilators from medical facilities with lower needs and redeploy them to hospitals in crisis.
I'm not going to let people die because we didn't redistribute ventilators.
The Trump administration has criticized states begging for supplies, accusing them of exaggerating the need.
The notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use.
But today from the president, a pledge.
We will take every action and will spare no resource, financial, medical, scientific. We will not spare anything. We'll get it back into shape, the Empire State.
In New York today, staggering numbers. More than 100,000 people testing positive for coronavirus. Victoria, a school nurse, is one of them.
I am worried about me. I don't want to go out like this. I'm afraid. But I'm afraid that I'm not going to get a chance to see my family again. I'm afraid for what's going to happen to our country.
Tonight, mounting pressure on the governors who have refused to issue stay-at-home orders. 1 week ago, KIV of Alabama was defiant.
We are not Louisiana, we are not New York State, we are not California, and right now is not the time to order people to shelter in place.
Today, there are 1,300 people testing positive for COVID in Alabama. 21 have died. Ivy now announcing a stay-at-home order effective this Saturday. Missouri tonight issuing its own order. In Florida, where a stay-at-home order only took effect today, cases spiked 20% in just 24 hours. Georgia held out until earlier this week, the governor insisting he only now learned that people without symptoms could spread the disease.
This is a game changer for us.
But that information has been widely known for weeks. President Trump has resisted pushing holdout states to act, but Dr. Anthony Fauci has been blunt.
If you look at what's going on in this country, I just don't understand why we're not doing that. We really should be.
Tonight, President Trump with an announcement about masks.
The CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary, you don't have to do it.
And in Michigan, a warning about the need for social distancing. Bus driver Jason Hargrove on Facebook saying one of his passengers couldn't stop coughing.
For you to get on the bus and stand on the bus and cough several times without covering up your mouth, that lets me know that some folks don't care.
4 days after recording that message, Jason developed symptoms himself and died this week.
If we just think about those workers across the country and just try to make sure to cough into our arms or cover our faces to try to protect those around us. And Whit Johnson with us again tonight. He's outside that temporary hospital at the Javits Center here in New York. We know that they will be taking coronavirus patients there after that agreement with the president. And late today with President Trump, just before we came on announcing the new CDC recommendations when it comes to masks, the Surgeon General already acknowledging that the federal guidance, in his words, has been confusing to the American people on this.
David, initially the White House was against face coverings for the general public. Now they are recommending non-medical cloth masks, but President Trump emphasized that it is voluntary and that he himself probably won't be wearing one. David?
All right, Whit Johnson leading us off.
I want to come way under the models. The professionals did the models. I was never involved in a model, but at least this kind of a model. But you know what? Hundreds of thousands of people, they say, I want much less than that. I want none, but it's too late for that. But I want very few people relative to what the models are saying. Those are projections. I hope they're wrong. I hope we're going to be under those projections.
Two questions on continuity of government.
How can you always have two? Why can't you have one?
Well, they're related.
Every time. I have three questions. I have two questions. Can you give me one instead? Because you have a couple of other people. Go ahead.
Okay, I'll go with my second one. The governor of Wisconsin is now talking about delaying the primary, or at least not having in-person voting. So my question is, and I asked this a couple weeks ago, I want to see if you've made any progress on this. Looking ahead to the fall, are you taking steps to ensure that the general election will happen even if this pandemic has reemerged or hasn't gone away?
The general election will happen on November 3rd. In Wisconsin, what happened is I, through social media, put out a very strong endorsement of a Republican conservative judge who's an excellent, brilliant judge. He's a justice. And I hear what happened is his poll numbers went through the roof. And because of that, I think they delayed the election.
Concerned about people going to in-person voting?
I don't know. Why didn't he do it before? He's doing it right before the election.
But do you think
Excuse me. Why did he do this 2 weeks ago? All of a sudden, all of a sudden an election which is taking place very soon gets delayed. Now, I just endorsed him today, and it was a very strong endorsement. His polls, he's gone very high up, and all of a sudden the governor comes out, the Democrat governor, by the way, comes out and says, oh, we're going to move this election. So I don't know. I hope you're right.
But do you think every state in this country should be prepared for mail-in voting?
No, because I think a lot of people cheat with mail-in voting. I think people should vote with ID, voter ID. I think voter ID is very important. And the reason they don't want voter ID is because they intend to cheat. When you get something, when you buy something, you look at your cards and credit cards and different cards. You have your picture on many of them, not all of them, but on many of them. You should have a picture on your for voting. It should be called voter ID. They should have that. And it shouldn't be mail-in, it shouldn't be mail-in voting. It should be you go to a booth and you proudly display yourself. You don't send it in the mail where people pick up all sorts of bad things can happen by the time they sign that, if they sign that, by the time it gets in and is tabulated. No, it shouldn't be mailed in. You should vote at the booth and you should have voter ID. Because when you have voter ID, that's the real deal. Thank you very much. We'll see you tomorrow.
We go back to
update on the domestic travel. Secretary, why did the website definition of the stockpile change? Why did the definition of the stockpile change this morning on your website?
Now issued, and the president made this announcement, a new recommendation regarding what's called face coverings. In light of new evidence, the CDC now says they've released an official statement. The CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. They said grocery stores, pharmacies, especially in areas of significant community-based transmission.
1,000 Americans have died over the last 3 days alone. Now, as a whole, from the stats and the data, there are very few deaths among young people and even middle-aged Americans. According to the data, older Americans are most at risk from COVID-19, as we've seen. In Louisiana specifically, 74% of the dead were 60 years old or older. In Washington State, that is 93%. And in New York City, 69% were at least 45 or older. So far, more males than females have been affected. While we grapple with the harsh reality of the pandemic and all the data surrounding it, there is another hard truth tonight, and that is the crushing effect on the U.S. economy. For the first time in almost a decade, the U.S. suffered net job losses, shedding more than 700,000 jobs.
That if you have to get a test and then you need treatment for the coronavirus, you won't have to spend a penny. All of that will be taken care of by the federal government. They will pay for treatment, for testing and treatment of coronavirus. When the president was asked, what about the 11 million undocumented people who are here in the United States, including maybe 700,000 dreamers, the president said, we'll talk about that at another time. Let's bring in Caitlin Collins, our White House correspondent. Caitlin, I'm anxious to get your thoughts on what we heard.
What his own government is recommending and what he says he's going to do personally. Very similar, by the way. Do you remember it wasn't long ago that he had people crowded on the stage with him in front of the podium, sharing the same microphone? It was just this kind of outrageous disconnect that we've come to experience with President Trump and the whole notion of messaging appropriately to the public.
I want to play, since it's been a while since people may have heard of what the president said on the mask, let me play that sound again, because it literally contradicted the advice the second he gave it. Take a listen.
The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home. It's going to be really a voluntary thing. You can do it. You don't have to do it. I'm choosing not to do it, but some people may want to do it, and that's okay. It may be good. Probably will. They're making a recommendation. It's only a recommendation.
Also with me is Dr. Nahid Badalia. Dr. Badalia, tell me, first of all, now that the CDC is saying this, we know that there's essentially an order on this in New York City. How important is it to do this when you leave the house?
So I actually like the approach that Surgeon General Adams took, which is he said, listen, this is evolving. We know that we told you not to do this before, but the reason we are moving to this new recommendation is because the science has changed. And what the science is saying is that there's a percentage of people who are asymptomatic or pre-symptomatic, which means that before they get sick, they're still shedding this virus. That might get other people sick. And so I think that it's important to say it is a guidance. It's not, it's not everybody needs to do it, but the important points that he made were hand hygiene and why we want people to use face coverings, and also identifying why those are different than the masks that people are using in the healthcare setting. I think that's a better approach to sort of tell people what's necessary. You cover your face because you're protecting others from your virus shedding if you're sick and you don't yet know.
Into society with its capability of efficient spread and morbidity and mortality. That was it. But what could have been different, and this is something that people are going to reflect on, when this is all over, as they try and analyze what actually happened, is that if we had known that this was highly transmissible early on when it was just in China, I think other countries would have maybe been more quick on the trigger to try and inhibit travel from China to their country. Because remember, it started in China, and then China, by the fact that there are so many Chinese people and travel is part of our daily existence in this planet, that there would maybe have been more attention paid to the possibility that just pure travel from China in general, but certainly from Wuhan and the Hubei district, is something that could start an outbreak throughout the world. So that delay in transparency, I think, likely had an impact on what I just said. The awareness that this could seed the rest of the world.
All that points right back to Chinese officials, doesn't it?
Looks that way.
And I want to be careful about how I ask you this, but there are reports that there have been threats made against you, that security around you has been increased. And the question I have is this job more than you thought it would be? Is it now something more than you bargained for?
You know, Judy, as I've said often, this is the life that I've chosen, and I accept it. It is what it is. The thing that I don't like is the effect that it has on my family.
Well, we know you are working around the clock, and the country is very grateful. Dr. Anthony Fauci, thank you very much.
Thank you, Judy. Very good to be with you.
In the day's other news, the combination of huge job losses in March and surging coronavirus deaths sent Wall Street tumbling. Is with us again to tell their stories.
This week, desperate pleas for medical reinforcements went out from many of the nation's governors.
Administrators, doctors, nurses, we are calling on you to step up and step in and meet this moment.
We need to have folks who are willing to come return to service.
If you don't have a healthcare crisis in your community, please come help us in New York now.
New York Governor Andrew Cuomo said 1 million additional healthcare professionals would soon be needed there, a state that has become the epicenter of the pandemic in the U.S.
I'm volunteering because this is the way that I can continue to give back, to New York City. I'm a lifelong New Yorker.
Dr. Jane Bedell spent years treating sick patients during the AIDS crisis and for several decades was a primary care physician and public health official in the Bronx. She retired in February and was set for a trip to Wyoming with her son this week.
I had planned kind of a very unstructured, kind of lackadaisical approach to retirement, honestly.
But 2 weeks ago, the 63-year-old scrapped those plans and instead signed up for the New York City Medical Reserve Corps.
I feel compelled, even in retirement, to step a little bit forward in this moment and to give back in whatever small way that I can and to join with my city in this response.
Another potential source of help, immigrant doctors. Some states like New York and New Jersey are granting immigrant doctors who fall short of some requirements temporary licenses. The Migration Policy Institute estimates some 165,000 health workers who were foreign-born have skills that aren't fully utilized because of rules requiring them to relicense or retrain. And in states with some of the highest numbers of cases, medical schools are now rushing to graduate students early and assigning them to hospitals most in need.
I just virtually graduated from medical school.
On Tuesday, Lauren Caldwell became a doctor while sitting in front of a computer for the University of Massachusetts Medical School's entirely online graduation. She missed the chance to walk across the stage in a cap and gown, but her training will be put to immediate use in one of the university's healthcare facilities.
I'm full of emotions. I don't know if I should be excited, happy.
This definitely isn't how I imagined it, but I'm really excited.
Dr. Taylor Shortsleeve is one of Caldwell's classmates. He feels both enthusiasm and uncertainty right now.
My mom's an NP, and she does primary care. She's particularly worried about me because, the mother-son relationship, she doesn't want me to come down with the coronavirus. I had asthma as a kid, so I'm a little worried myself. But other than that, I kind of quell everyone's fears by saying we're going to be protected, and this is my calling. This is what I want to do.
Newly graduated doctors likely won't see the most critically ill patients, but some other young doctors are already in the thick of it and are being put to the test.
Nobody ever thinks that they're going to go into residency and get hit, by a pandemic.
Reina Gonzalez came to New York from Puerto Rico 2 years ago to start her residency in internal medicine at Mount Sinai Beth Israel Hospital.
I've been receiving a lot of these patients. It's really tough because they come really short of breath. They really say, I can't breathe. I can't control this fever. Being with that first patient, but I'm like, I really want to help you, but at the same time, I don't know what you have. I don't know how this can affect me. my life, my loved ones. It's the uncertainty, like not knowing. We're doctors, we're researchers, we're scientists, we're used to knowing, having the answers, and not knowing. It's something we're not used to, at least I'm not used to.
For older doctors like Dr. Bedell, some of the personal risks are even higher, especially since she's a recent cancer survivor with hypertension.
My family put a lot of work into my recovery, for which I am forever thankful, and my neighbors and my friends, and this might just piss them off if I got sick.
That's why some have questioned whether it's prudent for retired doctors to come back. Dr. Bedell says she'll likely not be assigned to high-risk jobs, but instead offer support to take pressure off of other doctors.
I don't want to clog up an emergency room spot or a hospital bed or, oh my goodness, no, do not have anyone on a ventilator that you could have prevented from using that unbelievable, valuable resource.
These will be our first days and weeks as doctors.
But for graduating students like Columbia's Maggie Bogardus, the crisis offers a unique opportunity, and she says she's grateful to serve in this moment.
What I'm going to take with me is how much it's brought people, specifically in the health world, together. I have been seeing and hearing really incredible things and unprecedented things in terms of what people are willing to do and how they're willing to help. That's why we're here, and that's why we're doing what we're doing. I think it's a really poignant reminder as we're starting off on our careers.
For the PBS NewsHour, I'm Lisa Desjardins.
And now we turn to the analysis of Shields and Brooks. That is syndicated columnist Mark Shields and New York Times columnist David Brooks. Hello to both of you. We are keeping our distance from one another as we know we absolutely have to do. When we were together the last time, the three of us, it was 2 weeks ago, and at that point there were 15,000 coronavirus cases in this country. 200 deaths have been recorded. 2 weeks later, it's 270,000 deaths and 270,000 cases, 7,000 deaths. How are we doing as a country, David, in getting our arms around this?
Yeah, and in 2 weeks we could be seeing another higher shoot up in those lines. I don't think we can say things are confidently being handled. What's happening to the Comfort, the naval medical ship in New York State, is something of a regulatory travesty. The fact that tests are a third, some of them are failing by a third, positive, negatives, positive, or false positives, false negatives. Some of the uniforms and supplies are still not getting to New York State. So it does not look like we have mobilized the way you would think a country with a first-class Defense Department or a first-class set of bureaucracies would mobilize. And so it's worrisome. Take aside from all the politics. It just doesn't seem like competence.
Mark, what does it look like to you?
Well, I don't disagree, but I would add that at least there's a consensus now, if not unanimity, that this is a serious, grave national calamity. The president's moving on it, I think, made a difference, and he's brought with him the folks at Fox News, who bring with them a very large chunk. There's no longer any body in the country that argues that this is some sort of a Democratic hoax to jeopardize the president's reelection. But there has not been that assumption of national leadership, at least of a constant and consistent manner. And that I think remains a problem.